talked with public health experts and business leaders and local elected officials all across the state. Overwhelmingly, the response I heard is that we need an all-hands-on-deck approach to stop the spread of COVID-19 in Wisconsin. In fact, business leaders have suggested that it's imperative to slow this growth of the disease and that the state cease all non-essential businesses statewide. And folks, all hands on deck means you too. I know this has been difficult and it's disrupted the lives of people across our state, but here is the bottom line. Folks need to start taking this seriously. So today I'm asking for your help. Very simple. We have been working hard to ensure that the health and safety of the people of our state as we have responded to the COVID-19 in Wisconsin. We've taken some important steps, but folks, this is important. Time is of the essence. So today I'm announcing we'll be issuing a safer at home order tomorrow. As we've worked to respond to and prevent the spread of COVID-19, we've had to listen and daily, by minute, to our public health experts and to be mindful of our proactive steps that we could and will have those things impact our frontline workers and our most vulnerable in our communities. That's why issuing a safer at home order isn't something I thought we'd have to do. It's not something I wanted to do. And it's not something I take lightly. We're all in this together, and we need to help stop the spread of COVID-19 and flatten the curve to ensure that our doctors and nurses and healthcare workers have the opportunity to do their important work. You can still go out and take a walk, go for a bike ride, walk the dogs. It's good exercise and it's good for everybody's mental health. But please don't take any other unnecessary trips and limit your travel to essential needs like going to the doctor, grabbing groceries, or getting medication. Workers providing essential care or services in our communities will be allowed to continue to travel to and from work. There will be additional details tomorrow about what this order means for you. But I wanted to give everybody the opportunity to prepare and plan ahead so that you can help do your part to keep our friends and our neighbors and our communities safe. Now let me fill you in on some things we did this weekend in our efforts to protect you from COVID-19. On Saturday, I directed the Wisconsin Emergency Management to ask FEMA, the Federal Emergency Management Agency, to assist our state in obtaining the protective medical supplies for law enforcement officers and firefighters who are at risk of direct exposure to COVID-19 while performing their jobs. This request includes 50,000 non-surgical masks, 10,000 face shields, 11,000 coveralls, 3,000 N95 face masks, and 35,000 pairs of protective gloves. FEMA will use this procurement process to help fill those orders. The request comes in addition to the state's ongoing efforts to obtain personal protective equipment, or PPE, from the Strategic National Stockpile for healthcare providers. I'm also calling on federal officials to help identify additional resources that we can make available to those who are fighting COVID-19 on the front lines. Frankly, folks, this pandemic is a bigger challenge than any one governor, agency, or unit of government can manage on its own. That's why I've asked experts in the private sector to share their time, talents, and expertise to help us get a handle on this. My great appreciation and shout outs goes to Epic Systems, which will provide project managers and data for our efforts, Exact Sciences, which will boost our lab testing capabilities, Promega, which will be producing the important reagent materials to be able to do the testing for COVID-19. And I've asked representatives from the University of Wisconsin Health and Medical School and the Wisconsin Hospital Association to be part of the State Emergency Operations Center. I'm deeply grateful for all that they would do to step up to the plate this way, and thanks to all of them, but there's many others across the state. In addition to the assistance from our private partners, throughout the past week, we've been working with stakeholders on organizing 5 strike teams that are operating out of the Operations Center to focus on 6 key areas: specimen collection and laboratory capacity, personal protection equipment and essential supplies, isolation facilities, surge capacities, healthcare worker, child care, and also contacts tracing and surveillance. These task forces will help ensure our healthcare workforce have the resources they need to serve folks across the state. It is critical that we have these task forces in place before issuing a safe at home order. We've made great strides in all of this work, and we will have many more announcements in the days to come. I am mindful that this is a challenging time for all of us. So on Saturday, we also announced an extension of the tax filing deadline. Both state and federal taxes will now be due July 15th. I, along with Revenue Secretary Peter Barca, believe that the last thing that you should have to worry about now is a looming tax deadline. Another important date that we want you to know about and make earlier is voting on April 7th election. I continue to urge all eligible voters to get an absentee ballot through myvote.wi.gov. I encourage that. My wife and I just did that the other day. It's very easy. If we can do it, you can do it. This will make things safer for all of us and will give our county clerks room to safely carry out this important privilege of our state, that is voting. Again, I continue to offer my thanks to everybody in Wisconsin. This is a challenging time, but we will get through it, and we all have to work together. So thank you very much. Now I want to introduce Secretary Designee of the Wisconsin Department of Health Services, Andrea Palm.
Thank you, Governor, and thanks to all of you for joining us again today. I want to begin by echoing the Governor's sympathy for the families and friends of the people who have died from COVID-19. These deaths are heartbreaking and compel us to work harder together moving forward. I want to start today updating you on where we stand. We have recorded 7,050 negative tests and 416 positive tests. We remain in the state of Wisconsin with 4 deaths. As is our usual practice, these numbers will be published on the DHS Outbreaks webpage shortly. So we're hearing the phrase flatten the curve a lot lately, but what does it really mean? It means that together we must minimize the number of people who get COVID-19 at the same time. It makes logical sense, right? The larger the number of people who have the disease at any one time, the larger the subset of those people who will have severe illness and require hospitalization. So if our healthcare system is going to have the capacity that it needs, and that means enough beds and ventilators and frontline healthcare workers to save lives and treat those who require hospitalization, we must minimize the number of Wisconsinites who have COVID-19 at the same time. And the way we do that is to double down on the efforts we're taking together to stop the spread of the disease. That is good for the people who are very sick, it is good for our healthcare providers and first responders, and it's good for you because it means you are taking the precautions that are necessary to keep from getting sick and spreading the illness to others. To that end, at the Governor's direction, tomorrow I will sign the Safer at Home order to further protect Wisconsin from COVID-19. This is a necessary step to slow the spread of the disease and allow us to continue to prepare the healthcare system for this pandemic. As the Governor noted, we are working through the final details and will have more information for you tomorrow. But we need your help to flatten the curve and protect our healthcare system and our most vulnerable citizens. That will take a deliberate and continuous effort by all of us to stay home. You will be safer, your communities will be safer, and Wisconsin will be safer. Also, please remember to continue your good hygiene practices. Cover your coughs and sneezes. Wash your hands frequently with soap and water. And whenever it's possible, we encourage you to use telehealth to keep visits to clinics and hospitals to a minimum. Again, for your protection and for the safety of our frontline healthcare providers. Additionally, if you're having symptoms, please call your doctor before you go to a healthcare facility. We know that older adults are particularly at risk for complications from COVID-19. And just as schools are a major source of nutritious meals for our students, meal programs are important for the health and well-being of Wisconsin's older residents. So I'd encourage you to go to our DHS webpage where we have spelled out how this important service can continue to be provided safely. Over the last several weeks, DHS has had the full support of our state government. I want to thank Governor Evers and our colleagues across the state for your partnership. We are all working, along with our local public health departments and private sector partners, to protect the health and safety of Wisconsin residents. Thank you for your efforts during this challenging time. They are greatly appreciated. And now I'm going to turn it over to Major General Knapp, who is the Wisconsin National Guard leader.
Thank you, and good afternoon. This is Major General Paul Knapp, the Adjutant General and Director of Emergency Management for the state of Wisconsin. Currently, we have more than 300 Wisconsin National Guard citizen soldiers and airmen mobilized to state active duty to assist the state in its COVID-19 response. To date, we've completed a handful of missions. One of them was returning the cruise ship passengers transport mission. So what they did is they flew those passengers back into Wisconsin, and then our National Guardsmen transported them to their home of record. We also have 6 medics dispatched to the senior living facility in Grafton, and they should be completing their mission there in the next day or so, as they'll get pulled back because the local facility has been able to retain additional staffing to cover their staffing shortage. And that's a great example of what we're designed to do as a National Guard in backing up the Department of Health Services in this crisis. When there's a shortage in something like in that area, particularly having to do with medical in this case, we can come in the short term while the local facility adjusts their staffing and recruits more people to complete that mission, and then we'll bring our folks back. One other thing I'd like to talk about today revolves around the State Emergency Operations Center and one of the initiatives that we've been working hard on and we're getting ready to roll out. It's a PPE buyback program, and we've created a website that should be live within the next 48 hours. And what it does is it offers to take in any PPE donations, or we're willing to buy back PPE from businesses that have closed as a result of the outbreak and no longer have use for the PPE, so that we can buy it back or take those donations and reprioritize them and get them out to the first responders and medical folks that need them the most. Some of the items that we're particularly interested in are the N95 particulate respirators, face masks, gloves, isolation gowns, face shields, surgical gowns, Tyvek coveralls, and thermometers. We'll house those materials in a secure state warehouse and then manage the distribution of them based on the priorities set forth, much like how we're distributing the Strategic National Stockpile, PPE. As the governor mentioned, we have a couple different streams of input for PPE from the national level, and the other stream is from FEMA, where we're particularly sending in requests to cover the needs of the local law enforcement first responders. What we'll be able to do then is make informed decisions to best maximize known critical resources in the shortest amount of time. There will also be flexibility in this platform where we can add additional critical needs, such as formula and diapers for our child care facilities, and hand sanitizer and other items that we definitely will need throughout this crisis. One of the things I'd like to just remind everyone is that as we go through this crisis, as a united state, across the state resources, is that everyone would use a calm sense of urgency in responding in this time of need. And at this time, we'd like to open it up for questions.
Okay, thank you. And a reminder that we are only taking one question per reporter today, and to maintain audio quality, please keep your phones on mute until it's time to ask your question. We'll begin question today with David Wahlberg from the Wisconsin State Journal. David?
Yes, hello, thank you. I believe Governor Evers specified how much PPE we've gotten from FEMA for first responders. Can you be more detailed about how much has come from the stockpile for healthcare workers and how much more you're anticipating?
Great question. I don't have that information right in front of me right now, but the most recent request was through FEMA, and the numbers I gave were, oh gosh, I certainly don't have those memorized. We'll get that information to you, David.
So David, I do have the numbers from the distribution from the Strategic National Stockpile, which is a part of the estimated allocation that we will receive, and I'm happy to run through those if you're ready. So N95 respirators, we received 54,709. Surgical masks, we received 130,326. Face shields, we received 24,816. Surgical gowns, we received 20,233. Coveralls, we received 104. And gloves, we received 72,044 pairs of gloves.
And from FEMA, I've found it. From FEMA, we have requested 50,000 non-surgical masks, 10,000 face shields, 11,000 coveralls, 3,000 N95 face masks, and 35,000 pairs of protective gloves. And that is exclusively for our law enforcement officers and firefighters. I will say, even with those two, we are still, that's not an end point for us, is what I'm saying. And it's critical that we have a good start, but we will be continuing to seek out other sources if we need to for that.
Moving on to Mitchell Schmidt, also with the Wisconsin State Journal. Mitchell? Mitchell Schmidt?
Hello, can you hear me?
Yes.
Yeah, sorry. Yeah, thank you very much for the call today. I was curious if, I know that the plan right now is to continue with the election on the 7th. I'm curious, we've kind of heard concerns from some poll workers about not being able to have enough to staff those. If that does become the case, or even if it's like an election day shortage like Illinois saw, is there any sort of plan in place for kind of addressing that, whether that might entail having National Guard members there? I was just kind of curious how you kind of plan to address potential shortages.
Well,
Hi, this is Brian Nelson, the Governor's Chief Legal Counsel, and I can answer that question for you. So at the State Emergency Operations Center, one of the task groups that's set up is then to provide logistical and supply support for the Wisconsin Elections Commission and the clerks around the state. So their task is to make sure that there's adequate supplies, including cleaning supplies and hand sanitizer, ballots, envelopes for ballots, and other materials that they need. We're also looking at everything that we can do to make sure that the election can be held in a fair and safe manner. And that's why, as the governor has mentioned numerous times before, and a record number of people have done this, it's very important that people today request an absentee ballot. And anyone can do that by going to myvote.wi.gov. We've seen record numbers of people to do it, and it's the safest way to vote and participate in our democracy.
Thank you, Mitchell. To Eric Gunn now from Wisconsin Examiner. Eric?
Thank you for taking this.
Over the weekend, there was a statement from the GOP legislative leadership urging against shelter in place. Governor Evers, have you been in communication with the Republican leadership of the legislature today, and what kind of response, if so, have you gotten from them about your plans to institute this new order?
Yeah, I've been working with all sorts of folks, local leaders. I've been on the phone constantly for the last several days on this issue. Business leaders, I had a conference call last night where those business leaders were insistent on having the safer at home order, as well as federal officials. I have not personally connected with the leadership yet today.
Thank you, Eric. To Robert Chappell from Madison 365. Robert?